Let's get straight to our first guest in this hour, Sir Graham Brady. He's the chairman of the 1922 Committee, Conservative MP, and one of those joining the COVID recovery group, urging the government to, get life back to normal as soon as possible. Good morning to you, Sir Graham.
Good morning, Julia.
We are waiting still. Everyone's on tenterhooks for what we're going to hear on Monday from the Prime Minister after it's rubber stamped by the Cabinet in the morning. We're going to hear in the afternoon in the House of Commons what the roadmap is. There's a lot of speculation in the papers about what's going to happen. I think March the 8th, at least we know primary schools pretty sure are going to be going back then. But other than that, a lot of it is speculation. A lot of it is people sort of, basically elbowing each other to try and sort of get the Prime Minister's ear. What are you expecting to hear on Monday?
Well, I think we know we will hear some good news about schools, although it's not clear whether it's just going to be primary schools or whether we'll get all schools back. Personally, I think we ought to be paying much more attention to the damage that's being done to the interests of all children and a great many younger people who are missing out not just on education, but on their social development as well at a really critical time in their lives. So I hope that will be as quick as possible. But we also need real clarity for so many different groups of people, whether it's businesses that have got to plan their reopening, whether it's the increasing clamour that I and I'm sure all my colleagues are hearing from people who have relatives in care homes, some of them with dementia, who don't know why they're not allowed to have visitors, and it's causing real anguish for them. So I think that as we hear this continuing wave of good news with the vaccines, both the rollout of the vaccines and their efficacy, I think it's going to be the pressure that's coming from people saying, okay, so many of us have been vaccinated, let's now have some of the benefits of that. That's going to drive this forward.
Well, indeed. I mean, this is the thing. We were told by the Prime Minister back in February, and it was a very, very straightforward, simple statement about what we would have to do before we could actually see us, coming back out of lockdown. He said, if the rollout of the vaccine programme continues to be successful, I think it's successful beyond our wildest expectations, we can agree. He said, if deaths start to fall as the vaccine takes effect, well, we've seen that. I mean, deaths are plummeting. 7-day deaths down 26% in just a week, and we've seen them come down by more than 50% from the peak. Said, and critically, if everyone plays their part by following the rules, well, yes, people are out and about who are allowed to be out and about. I'm allowed to travel to work and back. Other people aren't, but people are, it seems to me, obeying the rules. He says, then I hope we can steadily move out of lockdown, reopening schools after the February half term and starting cautiously to move regions down the tiers. All of the things that he said at the time would be the criteria to set to return, for schools being the first thing to come back. Well, that would be after half term. After half term, maybe he meant like 2 years after half term. I think we all thought he meant in the Monday after half term, which is next Monday. Those have all been fulfilled. Why have the goalposts been moved when it comes to doom and gloom, when all of the data is telling us that the vaccine is working, it is saving lives, it is preventing hospital admissions, and it's preventing infections?
Yes, and we were told, weren't we, that we could hear the sound of the hooves drumming over the horizon of the vaccine cavalry coming to save us, which I think obviously was very hopeful. It's something that I think persuaded a lot of my colleagues in Parliament to support the lockdown, the 6th of January vote. But I think the sound of goalposts moving would be much less heartening. So we need to make sure that doesn't keep happening. And from my perspective, I just say that, and this is always far too easy for government to fall into habits and for government to assume powers and then simply keep them. I would say that the danger, really, the fundamental danger, is that government starts to forget that these aren't powers that the government has. These are our lives. They are the private, personal, family and working lives of millions of British people who have had to give up elements of their lives. And so it's not just a matter for government to...
No, but this is it. People constantly talk about the government allowing us to do things and giving us the power to reopen a business or to go and visit a parent. I still find it absolutely extraordinary that in 21st century Britain, in a democracy, when we are not, I'm sorry, we are not in the grip of a brand new virus now. That was in February, March, April last year. We got through that in big emergency. We know so much more about the virus and what the risks are now, and what the risks of lockdown are. The fact that we have perfectly sort of apparently rational conversations about whether the government will allow us to go and sit on a bench with people in our own household and have a cup of coffee in a park and not face a fine. I find that quite extraordinary. I find it extraordinary that, like North Korea, people are banned from leaving the country. I find it extraordinary that children largely are banned from going to school, and that you're banned from driving to visit a relative who hasn't had any company for goodness knows how many months. I'm just not sure this is the country that I thought I lived in anymore.
It's very strange, Julia. I think people, our British people certainly are very tolerant and put up with an awful lot. I think there is a point where people then snap and decide that enough is enough. And I think that in this instance, it is very much bound up with the vaccine programme because people have been tolerant. They've accepted these restrictions on their lives. They've seen their children suffering. They've seen relatives who have been isolated for nearly a year now, in many cases, and they've put up with it, believing that they're serving the wider public good, but being told that there was a clear route out that was visible and that would be measurable. So then to be told, oh, well, actually, we decided there's something else that needs to be achieved and secured. I think that's the point where people get really pretty angry.
Well, do you think people are changing their actions on this? I know so many people who have, obeyed the letter of the law and the spirit of the law throughout this, and those in their 70s who've been very careful, and certainly from December onwards, have been, whether even those in good health in their 70s who've been very, very careful indeed, shielding and making darn sure that they wait until they get their vaccine. And apart from two people that I know in their 70s, every single one of those has now started making a decision to, I'm in a position to make a decision with myself that I'm going to now meet up with loved ones because I've had the vaccine. I no longer feel like I'm at serious risk, and I'm going to make that decision myself, whether it's outdoors or even indoors. I'm going to make that decision for myself. These are law-abiding people who've done what they feel has been the right thing all along, but now say, well, now I'm not so much at risk. I'm going to make decisions for myself. Do you think there would just be a gradual just breaking down of the cohesive feeling about lockdown laws, and it's that's going to drive the end of lockdown more than anything else?
Well, I think if government doesn't move at the right pace, and this is where I think it makes absolute sense for government not to fix exact dates for everything now, but rather to look at criteria. Because if we are seeing the rates of decline in positive test results, in hospital admissions, in people getting ill, and in the number of people dying, as you said earlier, if that continues at the same trajectory, in a couple of weeks' time, there really won't be very many people who are being discovered with a positive test.
Yeah.
And when we reach that point, people are going to be looking around and saying, well, why exactly can I not see my children? Or even more absurdly, I've been vaccinated, so's my brother in his 80s or whatever it might be. We've both been vaccinated. Why can't we get together and have a cup of coffee? And it's so patently absurd that it will discredit the rules if they don't move quickly enough. I'll just add that I think an awful lot of those people were behaving in that way, not because there were rules or laws, but because they thought they were doing the sensible thing.
And they would have done it whether there was a rule or not.
Absolutely.
Exactly.